Welcome to Young Money with Tracy Bissett, the advice show for young millionaires in the making. It's time for some $1 Million Straight Talk with Tracy, President and Chief Financial Fitness Trainer at Bissett Financial Fitness. Each week, Tracy's going to tell you what you need to know now at the beginning of your earning curve. Basic and advanced financial concepts made clear, healthy money habits and the missteps to avoid, and all the stuff that you can do to set yourself up for a future of fantastic financial freedom. Ready to lace up and start this week's financial fitness training? Let's do it, Tracy.
Welcome to the Young Money Podcast. I'm really excited. We've got such a special guest today, Dr. Jordin Wiggins. Welcome to the show, Jordin.
Thanks, Tracy. I'm glad to be here.
Well, it's fantastic. So Dr. Jordin Wiggins founded Health Overall so women's health concerns could be heard and addressed. She loves to create personalized healthcare plans for patients, acting as their wellness warrior in the battle for a life free of discomfort and full of potential. Some of the health concerns Jordin commonly treats include stress and anxiety management, depression, lack of interest, low libido, autoimmune disease, breast cancer prevention, and hormonal concerns. So welcome again, Jordin.
Thank you, Tracy.
I'd love it if you can start by sharing with the listeners what led you to start your business, what the day-to-day looks like, and just generally how it works.
One of the main driving principles at Health Overall is that our current healthcare model is failing women, and that's pretty much why I got started. For example, the antidepressant rate has risen 65% in the last 15 years, and women are 2 times more likely than men to be on an antidepressant. Also, 75% of those affected by autoimmune disease are women, and these women are constantly being turned away from their medical doctors and sometimes even specialists, getting told that their blood work is normal. So at Health Overall, we've developed a women's health framework that really gets to the bottom of and addresses these issues. So
that sounds great. And you must be giving hope to so many women who probably feel really frustrated.
Honestly, that is the best part of my job, is hearing the frustrations that people come in with and being able to do some advanced medical testing, give them answers, and then give them a plan that works for them. And when they come back, they're always so happy. So I love my job.
Well, that's good.
And I have a team of 2 other naturopathic doctors. So they are on board and treat different facets of women's health with me as well.
And would you say your day-to-day looks the same every day, or do you have days that look different?
So for me, 2 days per week is spent on business growth and development. This is something that I've really had to shift in the last 6 to 8 months because I am the sole owner of my corporation. I'm learning how important marketing actually is. And I needed that time to schedule meetings with my accountant, with my lawyer, and do all these things that actually make the business run. And then 3 days a week, I see patients. So those are long days back to back, but they're my favorite because, like I said, each new patient is kind of like a puzzle to me. So I like doing the testing, getting the results back, and then hearing how things went.
Well, that's great. And I know that you're so passionate about helping women solve their issues, especially people who've had concerns that have plagued them for many years, where you're kind of coming in like a magician and offering something that they haven't heard of before.
It's actually fascinating because sometimes we're using advanced testing to let us know what's going on, but we're focusing on some really foundational factors like dietary changes, nutrient replacement, getting proper sleep, all of these things that seem very simple when we say them, but they're not very obvious to the patient at the time. And the testing just makes that so clear.
I'm chuckling because I often suffer from headaches, and I had to go to these headache clinic sessions before I was allowed to go see a specialist. So we had to go through the importance of water, drinking, sleep, all of those kinds of things. So I'm chuckling because some of the things that make the most sense aren't always readily apparent.
Definitely not. And I think the pace that we live our lives today it's just go, go, go. And we're always thinking about what the next task is or doing numerous tasks at once. And simple things like getting enough water in during the day can be, not even on the to-do list.
Yes. I know I have to make a conscious effort to drink it.
And maybe you have a hormone imbalance, Tracy, that you don't know about, because that's a common cause of migraines, actually, or food sensitivities.
Could be one or both.
Yes. We should do the testing to figure it out.
We're going to shift gears a little bit. And I want to talk about your background, because at such a young age, you've accomplished so much to date. And I want you to think about in your life so far, what do you think's been the cause of your success? And if there's any key success factors you think, or themes that have kind of shown up over the years that you feel have contributed to where you are at this place in your life?
I think for me, it was personally experiencing these concerns with the healthcare system firsthand. So I actually wanted to be a medical doctor. I did a pre-med undergrad and even wrote the MCAT. But during my second year of my pre-medical degree, I started to be really anxious. I wasn't sleeping. I got acne for the first time in my life in my early 20s. And I went to my medical doctor and discussed these symptoms, and the offering was an antidepressant. And I knew that there was so much more going on, but I didn't know how to solve it. So I actually went to a naturopath myself, and all of these extra tests were run. We found out what the underlying factors were and were able to fix it. So I completely shifted gears and became a naturopathic doctor, but I didn't really want to stop there. I wanted to find a way that I could have this type of care be standard for women. Because if we're testing cholesterol and that's standard, why isn't hormone testing standard as well? So the success factors that I would say have gotten me to this point, first of all, grit is probably the biggest one, where just perseverance and passion that's daily what I do. The hurdles or the issues that will come up when I'm running a business of this size, after only a few years, it's been a lot of growing pains because of the trajectory that we've grown at, which is amazing and I wouldn't change it. But it's holding that vision of what I want for women that gets me through the really, really tough times. I'm definitely results oriented. So I don't have a background in business, but my very, very simple principle has been do more of what works and stop doing what doesn't. And that's really shown up in the financials for my business. And I definitely do not compromise for anybody. And that's if I have a team member whose vision doesn't align with me. If people call and ask why my prices are higher than some of my competitors, it's because of the quality and standard of care I provide. And if they're okay with that, awesome. And if not, I'm happy to offer them alternatives. But I've been pretty clear the whole time, and that's helped me, not pay attention to the driftwood and kind of keep my eye on the prize so I can keep moving forward and advancing my business.
Well, I think those are really fantastic key success factors that will resonate. And we've heard them from other guests on the show as well, but just that grit and perseverance, passion that you've got. I love how you framed it around holding the vision for what you want for women that's getting you through potentially tough times. Just having a simple operating premise, like do more of what's working, stop what's not. And the third one, not compromising. So being really true to your values and to your proposition for your clients and your patients to make sure that they're getting the best from you. So I think those are things we can all incorporate into our lives. Really great success factors.
Thank you. And I don't mean to make it sound like it was easy for me to learn those either, especially the not compromising one. It's my nature to want to help and want to make everyone happy. But again, if I just hold that vision and know what I want in the end, there's going to be some people or some situations that don't serve me anymore. And coming to terms with that, it's not that I'm a bad business owner or it's no fault of the other person either. It's just, it's not a fit anymore. Let's move on. It's better for both parties in the end.
Absolutely. And I would say that anybody's listening, I think they recognize that running a business is no small feat, and certainly nothing comes without effort, and certainly a lot of hard work and some challenges along the way.
Yeah, that's couldn't be more true.
So speaking of challenges, has there ever been a time in your business or something that you'd wish you'd known earlier in your life when it comes to financial matters?
Oh my goodness, yes. So I graduated 8 years of post-secondary education, $200,000 in debt, student debt, which I know we can go down the rabbit hole of it's good debt or whatever. But the issue with that was getting a business loan to open my business at that point. So I was 26 years old with no assets, $200,000 in debt. I was a very high risk lender. And to get a business loan, which first of all wouldn't have even been enough to open my business, and the interest rate that I was offered by every major bank, business development centers, it was almost laughable to be able to get funding to start my business. So I definitely wish I would have known that ahead of time. I maybe would have started putting money aside earlier, or I wish I would have known that, you do 8 years of school with the full intent of opening your own business. And then it was really hard to get a loan at that time. But in the end, it ended up being a really good experience for me. And this is where my grit came in again, because I found a landlord that was willing to kind of upfront some of the renovation costs for me starting my business. So I pay increasingly more on my lease every year, but that freed up some cash flow for me to get started. And also finding contractors and vendors that were willing to work on payment plans, which was awesome because I could sort of space that out as well. So I was able to open a brick and mortar business, pay for renovations, and also be debt-free and profitable in the first year of opening my business. And had I had a line of credit, I probably would have used it and I might still be paying it off. So I think what was a difficult situation to begin with ended up being the best thing for my business, just by me finding creative solutions.
Because I would imagine when you're going to school, they're not teaching you business skills about running your own practice, because they're teaching you how to be a doctor. Is that right?
That is correct. We did have a business class to the credit of my school. We did one class per term was about running a business, but I think that that's just not where our focus was at the time, because everything else is about the fundamentals of being a doctor, that you have one class and, you're kind of thinking, all right, I can learn how to balance books later. How do I pass this exam type thing? And the practicality of here's how you apply for a loan. This is your likelihood of getting one. All of that stuff definitely was not taught. So I think it's important to, you know what I would have done actually? I would have been talking to other naturopathic doctors opening their own business sooner. So now I have an amazing network that I can chat with, ask questions, and we all kind of help each other. But I picked that up over the last 4 years, and I probably should have started doing that, talking to people actually doing it a few years before I decided to open my own business. And I think I would have been able to prevent a lot of headaches.
Yeah, that's a really good point and a good learning. I would say also, in fairness to your school, not everybody is going to open their own practice. Most people are going to go and be employed by somebody else, so they don't care about learning those kinds of things.
Oh, I think that is extremely true for an overwhelming majority. And the class was focused on opening and running your own business, but majority of people don't end up actually doing it. And I don't think in any profession, I think the belief in the beginning when you're in school is that that's what you need to do, or that's the gold standard. But I think realistically, there's certain people that are amazing at doing the business piece, and other people that's just not where their strengths lie, and that's okay.
Mm-hmm.
Finding a good fit of somebody to work with who loves the business aspect like I do, and then my associates really like the day-to-day of seeing patients. So it ends up working out better for both of us because we're both playing to our strength.
Well, that sounds perfect. Now, when we talk about entrepreneurship and your business specifically, since you've started Health Overall, what have you learned that you think would help other entrepreneurs out there? And if it's money related, that's great. If not, other tips are welcome as well. And I think one you just had led us to was the importance of getting kind of a support system and a network of people who are already doing the same things you are, so you can learn from them. So anything in addition to that?
I think finding your team has been the most important thing that I've done. So finding people, I set the standard, finding people who meet that standard, they share my vision, and definitely not settling for less. I think that's really key. I can give you an example. So I kind of look at it because I'm a small business. So there's me and the people that I work with daily. So like employees and independent contractors that are sort of my mainstay. And then I contract out other areas. And I think it's really important that all of those areas see and share my vision. So if we want to speak financially, I've been in business for 4 years and I have fired 3 different accounting firms. So I'll give you a little example about this and kind of why I think it's important. I hired an accountant and a bookkeeper early on. It's not my area of expertise. And I wanted to move forward with that degree of confidence. I did not want to try and learn how to do these things myself. However, accountants tend to be really conservative, and that's awesome. And I pay them to keep their eye on my bottom line. But there were times where I would butt heads with my accountants because of the risk and expansion that I wanted to do. They would tell me, oh, are you sure you're just in business? What is it? Like 50% of businesses fail in the first 5 years. Like you should be more conservative. And I was sort of, well, this is what I want to do. I know it's going to work. And, look at my growth rate for the last, year 2 years, 3 years, I've outperformed every prediction that you've set for me. So what's to say that I'm not going to do it again? So basically, I think it's really, really important to trust your gut, find people that see that vision. Because initially I was thinking, okay, these are the accountants, they're the experts, they know. But I would not have had the growth had I listened to those conservative recommendations. So ultimately, at the end of the day, hire people for help, but know that it's your business. And if you think you can do it, you definitely can, and find somebody that would support that.
I think that's an excellent piece of advice you just said. And often when I'm working with business owners, I remind them that I may be giving you advice and recommendations based on my experience, but I'm not running the business and I don't own the business. And you have to take responsibility for the decision, and you need to make the decision that you feel is right for you with the input of my recommendation. So it's not that someone else should be deciding what's going to happen to your company. You need to run it the way that you want to.
Yeah, I think that's so true. And I also think because I was so young starting, and I'm only 30 now, I think there was that little bit of, these people are much older than me giving advice. They have so many more years of experience. So I think I sort of let myself get pushed around in the beginning, but finding a person or an accountant that would tell me exactly what you said, that's the ideal fit. And those are the people that you should be seeking to have on your team.
Yeah, it's just like anything, like finding a health professional, finding any other kind of professional. You need to find somebody who fits with you. So you just kind of click and you're on the same wavelength.
Oh my goodness. Yes. My patients ask me all the time if I will treat their children. And I say, not me personally, but some of my associates do treat children. And that's just, it's not my area. And I would much rather them be with a naturopathic doctor who can give them that best quality of care. And I'm not going to pretend like children are my forte when they're not.
Yeah, I mean, it would be not true to your values, and certainly not to the care that you're giving there. And you have a really focus on women. So you don't want to be diluting that if it's not your core expertise.
Exactly.
Now, money is one of those things that can influence your whole life, including your health, and really vice versa. When people are coming to you looking for answers on their health, how are they typically feeling? And generally, what are they looking for when they come to see you?
My patients are generally exhausted, overwhelmed, and really, really frustrated with the medical system. They've been to their family doctor and sometimes several specialists without any answers. So they're really looking for somebody to listen and somebody to explain what's happening to them, why it's happening, and present a solution that will work, instead of it being, here's a prescription, come back in a couple months. I had a patient that followed up with me for the second time about a month after I'd seen her the first time. Her concerns were irregular periods. She was fatigued. She was gaining weight despite exercising, and she had some digestive issues. Basically, we worked on hormone imbalance and made a couple dietary changes. And in a month, she came back and said her acne was clearing up. She was waking refreshed. Mood was much better. And she'd lost a couple pounds just from a couple really basic dietary and supplement products that I'd recommended based on looking at her blood work.
That's fantastic. And certainly the results that you would be hoping to see all of the time. And how many people had she been to see before she found you?
This patient had been to her family doctor several times and a dermatologist. And she didn't want to go on the medication recommended by her dermatologist. She was looking for something that didn't have quite as many side effects.
Okay. And that's a thing I imagine you hear from a lot of your patients. People are looking for a better way to get treatment and a more natural way to do things.
Yeah, definitely. I think the days of just taking a pill to make our health concerns go away that's just not good enough for patients anymore. And feeling fine isn't good enough for patients anymore. At least the patients that are coming for my care, they want to feel awesome and they want to achieve every day. Just so, status quo, kind of just getting by isn't good enough. And I love helping them do that.
Well, that's wonderful. And it must give you so much satisfaction when you're able to do that.
Yeah, sometimes I wonder who's happier, if it's my patients or me on these follow-ups. Yesterday, I was so happy to hear the success of one of my patients. I made a hand gesture and I had a full mug of tea. I spilt it all over my desk, keyboard, my notebooks. But I mean, hey, it was worth it. She feels amazing and I was excited.
Oh, that's fantastic. Now, based on your experience, what are some common health or life challenges that young adults are facing that they come to see you about?
This is actually interesting and almost alarming in a way, because young adults are coming to me more and more overwhelmed, and they're also experiencing something that we call anhedonia. That's the medical term, and it means the inability to feel pleasure or joy. It's a diagnostic criteria for depression, and I'm not saying that everyone is depressed, but more and more of my young adults are coming in kind of lacking that zest for life. They don't really feel as motivated to do things as they used to. They don't enjoy doing activities. So if playing hockey used to make them happy, or going to the mall with their friends used to make them happy, they're not enjoying those things anymore. So I'm commonly hearing themes from young adults, and that's, I'm miserable, I'm gaining weight, I'm stressed out, and I'm really unhappy. I don't have any interest in having sex anymore. And to me, that's something, those are all warning lights that there are things going wrong with their health, and we need to intervene and prevent it from getting worse.
Well, those are some concerning issues. And certainly once you're able to help people who are experiencing one or any of these things, how do they typically feel and what do they share with you?
Actually, like social media for this exact reason, because I'll get some Instagram messages and updates from my patients. And I just got one last week, and my patients said, I feel like a new human being. You opened my eyes to hormone imbalances. My mood's changed. I've lost 20 pounds and my energy is way better. I was really worried about spending the money to come and see you, but it's worth it because I feel amazing. So I love getting my Instagram or Facebook message updates from my patients, because it's a chance for them to kind of reflect back on how far they've come. And it absolutely makes my day when I know how well they're doing.
Well, that's fantastic. And certainly there's no better feeling than knowing that you've helped someone. And as you said, who's getting more joy and more happiness out of it, whether it's your patient or you.
Exactly. It's both of us feel better after these text exchanges, and there's always lots of emojis.
Oh, that's great. Now, if I can get you to leave a couple pieces of advice before you go with the listeners. First of all, as something related to financial well-being as an entrepreneur, what would you say to the listeners?
I would say to work really diligently on your money beliefs. For me personally, this was something that I didn't even know I had, and I didn't even realize was impacting me. So I hired a financial planner before I even sign the lease to open my business because I wanted help in that area. And I would definitely make sure that you're working with a financial planner that will work with you on that level. It's not only about dollars and cents, but it's what we believe about those dollars and cents. And I would say if you can't afford a financial planner, reading the book Worry-Free Money by Shannon Lee Simmons was an awesome read for me because it didn't only make things clear, money management for my business, but also personally. And it was super helpful.
Yeah, Shannon is fantastic. And we've had her on the show now twice because she has a new book out as well. You may not be aware, Living Debt Free, just released right before Christmas. So you might enjoy that one as well, Jordin.
Oh, I did not know that. And I'm going to Amazon Prime that after we finish.
It's very good. And her interview is very good. And secondly, in terms of advice for the listeners, in terms of health and wellness, what's some parting tips you'd like to share with them?
I'd say that my patients often gauge their happiness based on their professional success. And I think that this is completely backwards. They spend so much time and energy focused on if I work hard and, long enough hours and work, overperform, eventually that success will bring me health and happiness. But I do not find that follows. I hear it all the time. I'll be happy when I get the promotion. I'll be happy when I lose 10 pounds. I'll be happy when I get the new job. But I really think that it's the reverse that you should be focusing on and investing in your health now, because that foundation is what's going to give you the energy, focus, and everything that you need to be successful and happy.
I think that's great advice. And I've observed that throughout my career in banking and certainly with a lot of entrepreneurs as well. So definitely try to get it in the right order and kind of reprioritize what's most important to you in your life.
Yeah. And health is one of those things that when you have it, you don't really pay any attention to it. But then once you are struggling with something, that's when people worry about it. And it's just such a bigger problem to fix. So I think seeing a naturopathic doctor, even if you don't think there's anything wrong, there's definitely tweaks to be made to optimize and ensure that you're preventing health concerns from happening in the future.
Excellent advice. So what are you working on now, and where can our listeners go to learn more about you?
Right now, we have just launched our online program called The Hormone Code. It's a 30-day program that myself and the NDs that work at my clinic are really excited about because people don't actually have to live in a geographic area close enough to us. They can do this program completely online and learn more about the framework and the success factors for women's health. So we are super excited about the launch of that. And you can find me on our website, healthoverall.ca. We are also on Instagram at Health Overall Inc. And you can find me personally at Dr. Jordin Wiggins.
Excellent. Well, thank you so much for joining us today, Jordin. I think you've shared some really great insights with us. In addition to the key success factors that you've shared, I really appreciated your honesty and candor in talking about your experience when you tried to get the financing for your business. I think that is an experience that most people are not prepared for. And certainly having some guidance to navigate through that or some prior knowledge about what you might have expected would have been helpful. So I really appreciate that you shared that with the listeners. I also really appreciate the lessons that you've shared throughout your stories and some of your tips around finding the right people who share your vision to support you in your business, trusting your gut, and really that ownership aspect around it's your business, so make your own decisions. And I just love all of the positive, inspirational stories you shared about your patients and how you're able to help them. And whether that's how you've learned around some of your money beliefs and certainly your tips for helping people focus on their priorities in terms of their health so that happiness will find them sooner in life. I think that's invaluable. So thank you again for joining us.
Thank you so much for having me, Tracy. And I'm happy to share, because if my experience helps somebody else from not having to make those mistakes, it's definitely worth it.
Well, thank you again. So there you have it, listeners. Dr. Jordin Wiggins from Health Overall. Check out her website and check out their new program. Until next time, take good care and stay financially fit.
Hey, thanks for tuning in. To all you millionaires in the making out there, if you love this podcast, please subscribe on iTunes to keep your financial fitness training going. Oh, and leave us a review. And be sure to visit 2 S's, 2 T's, financialfitness.com to take your free financial fitness assessment. Find out how financially fit you really are. See you next week, young millionaires to be.